Welcome to the module for negative vacuum suction controller for medical devices training. So by the end of this, our objectives are to ensure that the negative wall suction controller is appropriate for the intended use, to be able to operate the negative vacuum wall suction controller safely and competently, be able to use any appropriate accessories, have knowledge of moving and handling and ergonomics when moving or repositioning the wall suction unit, and be able to clean and store the wall suction unit safely. So, suction is an essential safety item, should be available in all clinical areas. Negative suction is used to suction oral secretions, vomit, and apply suction via an artificial airway, and occasionally on chest drains or NG tubes as directed by surgeons. To check for damage wear faults and service date, check for obvious signs of physical damage to the controller, and then check the service sticker to ensure that the negative vacuum suction controller is within its service period. Within the trust, there are multiple types of negative suction controller available. There are high vacuum controllers, which are red, and they measure between 60 and 80 kPa. There is low vacuum controllers, which is orange, and that's between 0 and 20 kPa. There's thoracic vacuum controller, which is green, and that measures between 0 and 4 kPa. So this device should only be used by staff who's been trained and assessed as competent as per the NUH medical devices training policy. Ensure that there's visual and functional checks are performed before use. Ensure all accessories are available. A maximum of 2 drains on each thoracic suction port should be used, and adapters available from MESU, and ensure that the correct controller is selected. There should be a filter attached to the base of the controller, a yellow VACSAX tubing to connect the suction controller to the VACSAX liner, and a canister to put the liner in. Suction tubing also to connect to the anchor, the drain, or patient. And there's multiple colour liners, however typically in our area we use the black lid. The suction controller should only connect to a vacuum port. So, moving, handling and ergonomics. The total weight of the device is 200 grams. Ensure that moving and handling risk assessment has been completed if required. If in doubt regarding the moving and handling of the device, contact your local moving and handling link person or the authorized trainer for this device. So check the device is working, switch the suction controller on, set to its maximum pressure and occlude the VACSAX liner port. Watch the needle freely move to above 60 kPa. Release the occlusion and watch the needle drop freely to about 10 to 20 kPa, and switch the controller off and witness the needle fall to 0. High vacuum suction controllers should be left and set up to 20 kPa, ready to use, and they are only to be used for suction. So things that might affect the safe operation and accuracy of the device. If the canister fills, it may affect the suction pressure reached. So, suction pressure is required for oral, tracheal and thoracic. For oral suctioning, 20 kPa. For tracheal suctioning, you can also go up to 20 kPa. They don't ideally like you to go higher than that, as that can cause some damage. Thoracic suctioning is as prescription or in the medical notes. It's usually measured in centimeters of H2O, and its max is usually about 4 kPa. This pressure should be checked regularly and documented in the nursing notes. And then back onto oral and tracheal. The general rule is as little as possible. You don't have to do 20 kPa, but as much as needed, as airway is kind of all. Actions to take if there's an error or failure of the device. Remove the device from use after ensuring the patient is safe and unharmed. Complete a clinical engineering decontamination form detailing any error codes or messages. If the device is involved in an incident, ensure that the Datex number is recorded on the decontamination form. Ideally return the device to clinical engineering as it was set up and used. If this is not possible, take an image of the setup and ensure this is uploaded to the Datex incident form. Cleaning and decontaminating. Clean it as per NUH policy, which is typically green Clinell wipes. Ensure that obvious signs of dirt and contamination are removed. Vac-Sax liners should have a stopper applied and disposed of as per policy, and the filter changed if an infected patient has used the device. So when to change different suction tubing, yellow tubing should be changed as per local policy. It can stay in place for 2 years, however we change it yearly, and you'll see why in just a second. And the plain suction tubing that goes to the patient should be changed daily or sooner if clogged. So changing the filter. The filter gets changed as per local policy. For us it's yearly, hence why we do yearly on the tubing as well. Or when the filter is discoloured or turns pink. And to change the filter, simply twist the filter off and twist in a new filter. When to change the suction canister liner, typically change the liner when it's over half full, between patients, or as per local policy. So storing the device safely, ensure the device is stored in a clean and dry environment, ensure each bed space has access to a suction controller. And that concludes the module on the negative vacuum suction controller. Now, if you go find your local medical device trainer for a practical assessment.